Hello everyone, this is the O2 spot, the spinoff of the O.C.D. crew. This is 1/3 of the O.C.D. crew. Hi, my name is Otis Collier, and on this show this is the place where human movement and the why merges. And the purpose of this is to explain common movement issues with uncommon solutions based off science. Okay? So continuing from last week, this is week 3, okay? Last week was week 2, and we were talking about humans are not rabbits and how important unilateral movement is and how to unload and unload one side and load one side to unlock your brain and how that's important. Okay, so moving on with that, we're going to be talking about the pelvis, okay? And basically the direction of your pelvis. So where in the world is your pelvis facing? Okay? So this is really important of why you might have tight lower extremity muscles, particularly the hamstrings, like how you just stretch them all day long and they just always get tight, that you always have the sensation of being stretched. There is a particular reason why. There's definitely a difference between being tight and having tension, and also we're going to dip our toe into the idea of your pelvis. The alignment of your pelvis is going to tell your brain if you're in danger of dying or not. So I will definitely explain that. That's like a crazy little loop-de-loop. But yes, if you are new to the channel, please subscribe, okay? And follow me on Instagram at O.C.D. Versus. Also on Facebook, I think is Otis.Chris and Daryl Crew or Group or something like that. I'll have a link down there as well. You can always shoot me an email, ocdversus@gmail.com. If you have any questions, you want to converse about anything, any topic you want me to cover, I will gladly do so. Okay? Once again, my ideas are kind of influenced by PRI and FRS. I can never get that right. These stupid acronyms. I got like 100 of them behind my name. But anyway, yeah, I'm influenced by them. Also, Mike Zhao and Joe Gonzalez are heavily influenced me. I just kind of take their work and interpret of how I think that what they're saying and how I utilize what they're saying and everyone is saying and utilize in my practice. Okay, enough of the babbling, blah, 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 blah. Okay, so now we're going to talk about the pelvis and which direction it's facing. Okay, so here is a model of the pelvis, right? Boom. This is the front, the part you see right here. Part back here, that's the back of the pelvis, side of the pelvis, underneath the pelvis, top of the pelvis. So I'm going to flip it around. So what we're talking about is the direction of the pelvis, all right? And why people feel like they need to stretch their damn hamstrings all the time, even they stretch it all day. Got yogis that can put their knees in their mouth, but they feel like they got tight hamstring. They just have to stretch it, even though they have like 120 degrees hip flexion. If you're like an ortho geek, you'll understand that. So why is that? Okay, that's kind of like the first question that I have. Okay, this is also from a patient, so I will not reveal the name, but this is a patient. This is a question they have asked me. I stretch my hamstrings every day and they still feel tight. Why? All right. So the question I'm going to ask before answering that is, you have to ask what position is your acetabulum. Okay, hence the title of this thing. So the acetabulum, what is that? So that is this little thing here where the femur or the thigh bone kind of sits in there. All right, so right now, I'm looking crazy, but right now, my fists are basically the femurs, okay? This is the acetabulum, this is the femur. So you have to tell yourself which way is your acetabulum facing. Well, I don't know if people understand this, but your pelvis, they are interdependent. All right, so they like to work together, but they can work independently. When I mean work together, as in they like to oscillate at the same time, so they counterbalance one another, but they also can do the same action at the same time as well, and they also can do independent action. Like this can move upward, this can move upward on its own. It also works in the other plane. I'm sorry, this is where it really gets funky, okay? So if your pelvis is a certain position, that one doesn't move, so I have to use my hand. So if your pelvis is in a certain position, this is the back of it, this is the back, my fingers are the front, the pinkies are the bottom, the index finger is the top. So if you have a pelvis that is basically anterior tilted, it is externally rotated, and it's abducted, okay? The acetabulum on this one is going to be a lot different if the left pelvis is that and the right pelvis is posteriorly tilted, abducted, and internally rotated, okay? The acetabulums are sitting way different. Because they are sitting differently, the femur, the thigh bone, is going to behave differently, all right? So let's keep going with that, because the femurs and the pelvis are positioned differently on each side. Okay, each innominate is positioned differently. The muscle length of these innominates in the femur bone is going to behave differently as well, i.e. the hamstrings. Okay, let's go back to the hamstrings. The hamstrings attaches here. Okay, I'm sorry, you can't even see. Attaches here, the ischial okay? So the difference between tightness and tension, okay? Right now, most people feel tension, not tightness, okay? Neurological tension. Tightness basically is a muscle thing where it just won't move, like sarcomeres are kind of like stuck in glue. That's considered tightness. Tension, all right, if you think about how this hamstring connect, the hamstring muscles are kind of like connected to joints, to bone, really. So they're kind of like, think of it like they're crazy glue stapled on there. They can come off, but they like to stay with this spot. So if this spot is stapled and the hamstring connects it to the bottom of the leg, if that part is stapled, right? And I'm back here, if it's right here, and if I change the length tension of my pelvis, all right, so this is my finger, and I change the length tension of my pelvis. All right, so it doesn't change. It doesn't like stay here or rip off. It kind of goes with it. All right, but because muscles have elasticity in it, think of a rubber band. The rubber band, just tension is put into the rubber band, so it stores a lot of power if it's briefly done. If this is briefly done and it goes back. But imagine if it's stuck like that, all right? This is kind of feed into last week of saying humans don't run or gait, they hop. If you're stuck in a position, if your pelvis is stuck in a position in one pattern, you're only getting one type of sense of reference in your pelvis, then your hamstrings, then you're going to get a neurological sensation that your hamstrings are tight. When they're really not tight, they're just tense. They're on eccentric, they're overlong, they're over lengthened, all right? They're on eccentric load, stuff like that. So which makes you have the desire to stretch them all day long, all right? So you have to kind of understand where your pelvis is at before you go around to stretching your hamstrings. You're just making it basically weaker, You're basically, a rubber band is already stretched. I wish I had one, I don't know. If you have a rubber band that's already stretched, and then you go stretching it more, and then you go stretching it more, and then you go stretching it more, and if you do that long enough, eventually the elasticity is going to be gone. It's just going to stay. It's not going to spring back. It doesn't just come back like that. So you have to be very, very cautious of where your pelvis is at before you go around stretching, particularly your hamstring. This goes along with almost any muscle. Understand where your bones is at in space on your body before you go around cranking out stretchers, pec stretchers, abductor stretchers, and just constantly doing that. All right, so just be really, really mindful of that. Okay, so here is the second question from a patient. Can you explain why my hips feel crazy tight even after I stretch them, particularly in external rotation? Beautiful question. It goes back to the next one. Where is your acetabulum placed in your body? All right, so we're going back to the whole example again. Okay, remember, left side is anterior, is AB, externally rotated. Okay, so we're going to go with this one. So we're going to go with this one of that. So because your pelvis is in a certain orientation or a certain position, it influences your thigh bone, your femur, the head of your femur. All right, the head, your joints like to be in the center, so it can have equal placement on the joint. So it's not one side is wearing out more than the other. All right, but your pelvis is biased right now. It's in a certain position where it's biased. So what that does is, I have to make go this way. This is the outside. My fingers are the outside. This is the inside. I'm looking crazy right now. So what it's doing is, because it's favoring one side, your femur is kind of centrating back out, but it's biasing the outside part of the acetabulum. Okay? So when you try to go out, it feels like it's kind of stuck. You're getting a sensation that it's tight again, but that's more so tension because it's not centrated. You're not expressing the full capacity of the joint, of the capsule, really. You're not really expressing the full capacity of the joint. And what you're doing is you're kind of hitting bone and in the labrum and stuff like that, and you just want to keep stretching it because the body, you're not really stretching muscle. All right, you're starting to stretch other stuff besides muscle, and you keep going down that road, man, you're going to have problems. All right, so this is one of the reasons why you stretch external rotation. You do your pigeon stretch or your frog stretch or whatever. You can just insert whatever external rotation, hip rotation stretch you want, and you never really get better. All right, so you always feel like you have to tighten. Man, it's just like, regardless how many times you stretch it, it just keeps coming back. You want to stretch it. You could be like Gumby and have your thighs hit the ground, but you still feel like, oh man, this stretch feels great. I will invite you to look the other way of the joint of internal rotation. How much internal rotation do you have? It's very, very important to see that, of checking out internal rotation, because most of the time when you try to get all this external rotation, you lack internal rotation. Internal rotation usually goes first. When basically hip capsules are tight, that goes first. When your range of motion goes away, that goes first. And that's completely important, because in order for you to compress your lower body and walk on it, it needs to internally rotate. Okay? So back to the checks and balances, like I was talking about last time, where when one part of the body is doing one thing, another part of the body should be doing another. So let's take the leg. If the femur, the thigh bone, is doing one thing, okay? This is the thigh bone, okay? Thigh bone is doing one thing, and the shin bone is doing something else, okay? So don't you want, if this is doing one direction, it doesn't even matter which direction it does, but in this case it doesn't. I'm going to go one direction, or for me to counterbalance that, so we don't kind of just all go dumping on one thing, so we can stay where we're at. If this is going right, the other one has to go left. And you can see, if we do that, we stay on this axis, on the joint, and it behaves like a joint. So that is why you need to check internal rotation. So you're doing all this external rotation, you're just going to have this propensatory feeling to fall out in external rotation and do that and go further into that extension base orientation, okay, pattern. So you want to kind of get some checks and balances within your lower body, and definitely looking at internal rotation at the hip complex is vital. Okay, last question is, does my pelvis alignment have anything to do with one leg being stronger than the other? To keep it simple, yes. There is a bias of how I look at the human body through the PRI lens. And based off that lens, one side, your body favors one side than the other. It references one side than the other. Your center of your body is on one side. It's centered on one side of your body, your right side. So yeah, you're going to be more familiar with one side. than the other, your right side. Your body wants to stay on its right side. It doesn't really want to go left because it likes right. It's very good at right. Now, this can be confusing if a person is left-handed or left-footed. Whatever that means, if they're left-handed or left-footed, like, oh, I'm left-footed, I can kick, I can do better on my right side. Maybe, maybe not. I will ask yourself, are you more familiar with that side? Are you more skillful with that side? Do you learn easier with that side? But are you stronger with that side? Okay? Stronger is a very fickle term, but we're not going to get into that. But I would say that you are maybe neurologically more familiar with your left side to learning particular skills, but biomechanically, you like your right side. You have more into it. Okay, it's like almost like you fall into your right side to kick. It's almost like your gravity's helping you to get over there and stay over there. That's kind of covering the lower body. The upper body is a little different, but it's kind of the same concept. Basically, one side you're more familiar and one side you're not. All right, even though you have more power, you have more strength, you have more mechanical advantage on one side, you have more neurological familiarity on the other. So that kind of covers that whole one-sidedness and all that stuff. Oh yeah, ooh, I forgot about that. The danger part. Okay, so I mentioned earlier that if your pelvis is positioned in a certain way, that your brain, not your mind, your brain is going to perceive that as a very dangerous position and is going to do cascades of things in your body, chemically as well as biomechanically, neurologically, and physiologically in your body that is going to make your brain sense that is in danger. What I mean by danger, like caveman danger, like there's a tiger in your room, is chasing you, is trying to eat you. Okay, your brain is primitive like that. It still works that way. It still have those underlying safety mechanisms in it that you need to respect it. If you don't, it will just go unnoticed in your subconscious, underneath your consciousness. Okay? So what am I talking about? So let's dig into this slightly and quickly. So the fight or flight concept. Most people are very, very, very aware of fight or flight. If you're unaware, just Google it and you'll know what I mean. But fight or flight is basically when you're nervous. When you get nervous, you got the butterflies in your hand, in your stomach. You like, I'm anxious. I don't know what to do. So you either fight, you stay, you know what, I'm going to get through it. Or you flight, like, peace, I'm done with it. So there's a bunch of other responses happen when you get through these fight or flight situations. But if your body, but this is a stressor. You need a stressor to happen. And FYI, all stress is not bad. Your body needs stressors. So how you respond to the stressor is key. So if your body is in a state of stress, and mechanically, if your body is in a state, in a movement position that's unfamiliar with, it's stressful. Your body thinks it's stressful if you're in a position that you're unfamiliar with or you're apprehensive to get into. All right, so that could be anything. If you just think about, if you don't like laying down on your back and you lay on your back, you'll start seeing your breath increase, your heart rate increase, you'll start feeling anxiety, like, I just want to get out of this position. I don't like it, I don't like it, I don't like it. So yes, that's part of the fight or flight response. Anyway, I diverge. So anyway, if your body is in a state of stress, an unfamiliar body position, and you can't breathe in it, your body perceives that as danger. So because you need to live, breathing, inhaling, if you don't do that, your body perceives that as danger and is going to remember that and is going to do everything it possibly can to stay out of that position. Okay? So let's bring this back to the human body and what's going on with your pelvis. Remember I said your body favors one side of your pelvis, the right side. So if it tries to go and it's not very familiar with its left side, this is a biased point of view through the PRI lens, okay? So if you are favoring one side and you try to go to that left side and you don't really go, say you we very rarely go over there, nonetheless want to go over there. So you get to that left side and you start getting anxiety, your body start locking up. Your body doesn't understand this left leg. What are you doing? It's not sure what to do. It's not sure what to do. I'm sorry about that. It's not sure what to do. Wants to get over there. Apprehensive increase, anxiety increase, and it wants to get back on this side. Okay? So it wants to get back on the right side. So once you get into all of that, your body interprets that as danger. It interprets left side danger. Stay off that side. I don't want to go over there. Okay? So since it doesn't want to go over there, anytime you try to go on your left leg, walking, for instance, neurologically, your body is like, I have to get off this side as quick as possible. So I have to stay on my right side completely. All right? So you need to be able to oscillate and change your body position. You need to change your pelvis position in order for you to drop anxiety, drop intensity of trying to get onto that one side or the other. All right? It shouldn't be, I'm on my right side, I feel like I'm a 1 or 2 home, and when I get to my left side, it's a 10. That's a big discrepancy, and you need to be able to switch back and forth from both sides easily. If you can't do that, you have a problem, all right? And all these other things start to happen, high heart rate, breath rate. You start having these other responses happen to your nervous system. Now you're more sympathetic than parasympathetic. You can't relax. You can't turn things off. You're only referring to one particular reference site on your body and stuff of that nature. And it just goes on and on and on and on. Okay? So it's very important to understand this and appreciate this. How do you recognize this? You recognize these people where they're always on. They can't stop thinking. They're always in their head. They can't stop thinking. They can't relax. When you tell them to relax the muscles, like I am relaxed, and it hangs in the air. When they're always trying to assist you. They're always moving. They don't know how to stop. Another one is when they stop, they feel pain. Because pain is a sign of discomfort. So they feel pain. They feel better when they move. This is for my clinicians out there. They feel better when they move versus when they stop. When they stop, they feel the pain. When they move, they don't. So it's like, that's like a juxtaposed kind of thing. Like, what is going on there? You don't know how to shut down. Your body it's not familiar with relaxing and staying still. So it makes you feel discomfort to get you not to do it again. Okay? I hope that makes sense. If it doesn't, leave a comment somewhere down here. We can discuss it further. Tea or something like that. I don't know. But yeah, that's how basically your pelvic alignment can make you feel like you're in danger neurologically. Okay. So that's it for this week. Next week is going to be week 4, and we're going to be talking about posture. Straight posture is bad posture, and how that's killing your back. Okay. So if you have any comments, please leave it at the bottom. Make sure you subscribe to the channel. And tune in for next week. This is Otis, 1/3 of the O.C.D. crew. This is the O2 spot where we solve common problems with uncommon solutions. Take care. Be well.